What are the signs to look out for someone to really understand that, something has activated maybe a natural awakening experience?
It's an interesting question. With this medication on board, we can create an environment where somebody may have a true sense of safety and relaxation for the first time, and for some people forever. It's not an information that we get from the neck up like most of our knowing. It's like a full body knowing, but it does more than just what our orientation of Western pharmacology has been, which has largely been to suppress.
You had like a complete separate experience, kind of giving you permission to completely redefine yourself.
What has been a consistent thread in all of my career and non-career beingness in the world is existential angst, though. I really identify as an integrative psychiatrist. I'm open to integrating any aspect of healing, mind, body, spirit, soul.
A lot of what we're reacting to is not a lived experience. It's what we think. Is it also part of like future thinking or what we feel is going to happen versus, the actual present?
I have a teenage daughter who spends a lot of time on social media. That is not her lived experience. It is the experience of what is displayed on a screen. Retiring, like kind of now what? Like that spoke to a lot of like my worth. Was I missing something the whole time, or how do I be in this new phase and be happy in it? Like,
I'm actually working with a psychiatrist that is transitioning into integrative psychiatry, and we're noticing through our market research that a lot of other psychiatrists, especially in the holistic space, are offering this type of healing. So I'm curious, and I want to start with kind of just going deeper into exactly what that is, who it's for, and how it helps.
So I think of ketamine just as like another tool. It's a medication. It originally was used in the later 60s and 70s for pain management and anesthesia. There was some interesting research in the 90s using ketamine-assisted psychotherapy for alcohol use disorder. Through the research, we found value in ketamine as an antidepressant and really for suicidality in emergency room visits. It has a really quick onset of action, so it can help reduce suicidal depression day of. In and of itself, it's a good antidepressant, but it has 3 different mechanisms of action for change, which are utilized when we're thinking about integrating psychotherapy and not just delivering ketamine in and of itself in a medicalized environment. So when we couple it with therapy, ketamine, like most psychedelics that we've been researching recently, create increased neuroplasticity and reopen the critical learning window, which is an opportunity for enhanced learning and behavioral change. Increases cognitive and emotional flexibility. So if we couple ketamine with therapy, we can both amplify and expedite change. Ketamine also has an experiential type mechanism of action, which is specific to set and setting. So if you're working with somebody that you have a great deal of trust in and you have a solid relationship with the provider, and you have a low enough dose that if you have a diagnosis like complex PTSD, and for some who have never really had a felt sense of safety and connection in their life, with this medication on board, it softens up our conscious and unconscious defenses, and we can create an environment where somebody may have a true sense of safety and relaxation for the first time, and for some people forever. And this is a really strong felt sensations. It's not an information that we get from the neck up like most of our knowing. It's like a full body knowing that you get to hold on to in for the rest of your life. And you can reflect back on that in other therapy sessions and in other aspects and engagement in your life. So it does more than um, just what our orientation of Western pharmacology has been, which has largely been to suppress. Like
Right.
we will reduce your capacity to feel these difficult feelings, and so also probably reduce your capacity to feel all of your feelings for some people.
Right. Right.
So it's a different model that's really an expressive model as opposed to a suppressive model of psychiatric intervention.
Got you. So it's a psychedelic that where traditional pharmacological solutions may sedate some of your symptoms, you're kind of opening yourself up to a different type of experience with expert assistance.
Yes.
Got it. Okay, perfect. And as far as, who it's for, you mentioned like depressive episodes. Is there anything else along the lines where someone's experiencing that may benefit from using something like this?
Do you know what? It has been uh, researched and helpful for depression, complex PTSD, addiction, eating disorders, autism spectrum disorder, anything that w- uh, is inclined towards a rigid thinking process, any sort of narrow scope of thinking. Um, the ketamine can help expand the way we think about and see both the situation we're in as well as the opportunities associated with what's going on in the moment. Um,
Oh,
so I
that's very
almost,
interesting.
yeah,
Go ahead.
like I almost feel like it's more, the list is shorter for what it's not good for. Because
Mm-hmm.
even people experiencing existential crises or looking for personal and spiritual growth, change of life situations, transitions, divorce, big shifts in how we've thought about ourselves in the world, and then like, how do I think about myself now?
Mm-hmm.
Um, what we don't like to use it for is active psychosis because it can be destabilizing.
Mm-hmm.
Individuals that have a fractured sense of self, because you
Mm.
really need to have comfort and familiarity in self in order to be able to release it and surrender. Um, Folks with an active addiction to ketamine would not be a good candidate for it. Um, like other antidepressants, it can kick up a manic episode in a previously undiagnosed bipolar situation. So it's good to really do a comprehensive psychiatric and medical evaluation beforehand. And if somebody does have a bipolar disorder, you can treat the depressive episode of it, or you can treat the sort of the trauma associated with living with this chronic diagnosis, and how do I think about myself in the world, and what are my limitations, and how do I not feel limited by certain things that are different for me than other humans or than what I thought life would be like. Like all of that can be expanded on. But for some people, it's nice to have a mood stabilizer on board and or just be in relationship with your psychiatrist. Hopefully your psychiatrist is doing it with you so that we could be careful to see if any mania kicks up and then attend to it
Right.
in the moment.
Right. That's so interesting that we're having this conversation. My sister left this book, this magazine for me to read later, and the heading of it is actually called Natural Awakenings. And so this experience that you're kind of describing, I'm curious as to if some of the mechanism of action can be kind of activated by, a life-changing event, or do you believe that maybe, this experience can actually happen naturally versus some type of assisted medication?
Of course, it can happen naturally. Yes. Um,
What are the signs to look out for to really kind of for someone to really understand that, something has activated maybe a natural awakening experience?
it's an interesting question, and I wonder if you could be more specific in your question because,
Yeah.
how would you know if you're more awake?
Yes. Yes. Well, I'll speak from personal experience. How about
Okay.
that? And then we'll go from there.
Yes.
So I originally come from the pharmaceutical background. So I was a neuroscience long-term care sales representative, and was completely in love with what I did. And then when I transitioned into more lateral positions and working in different disease states, I realized that there was another part of medicine that was being overlooked, which
Hmm.
triggered me to open up my own consulting business and focus on helping holistic practitioners grow their brand. So that's kind of like
Mm.
the origin of my story. And through that experience and really trying to find another sense of identity essentially because everything was tied to my career, my mind in started to expand, but I also while also carrying symptoms of what would be considered depression, right?
Mm.
Just through an unfulfilled career. So, through that transitional process, I found myself more in a spiritual sense, really kind of redefining myself, my identity, my life, and really expanding my mind to really dive into things that once were, not part of my experience. And I was someone who was very structured and rigid and high performer. And so now through that process, I can now see life from a different type of perspective.
Mm.
So when you're describing the experience that one may have from this type of ketamine assisted psychotherapy,
Yes.
I'm wondering if that's something that would have been beneficial to me at that time because I did seek therapy. However, I didn't find it as useful. And I found the steps that I took on my own, to really find myself was actually more beneficial than seeing an expert. So I'm wondering, just for anybody listening, especially since this is a career to calling type of podcast, if someone experiencing that type of change in their life, whether this type of therapy would be useful and maybe could possibly speed up or, if necessary, the process.
I can't help but also wonder, like, what were the steps you took? Because, like,
Yeah.
I think it's an individualized recipe. So,
Yeah,
like, yes,
absolutely.
this
Yeah.
certainly could be helpful, but,
Right.
like, maybe the steps you took would be helpful. Maybe spending more time in nature, maybe, um,
Yes.
increasing your yoga practice, maybe shifting your orientation to, um, like, anything that will allow us to be more cognitive and emotionally flexible,
Mhm. Mhm.
would benefit the evolution and growth of us as humans and
Mhm.
allow us to feel more connected. And I think connection will um is like directly proportional to happiness
Mhm. Mhm.
because we're social beings.
Right.
Um so I don't want to have my message be that, like, this is the right way, but this is
Right.
one of many ways. Yes.
One of many ways. Yes,
Yes.
absolutely. So, like you mentioned in the beginning of the podcast, it's a tool, right?
Yes.
So and every experience is individualized, but some of those steps and just the work, the coaching, the career coaching that I've done with other clients, we've noticed that a lot of the clarity that they're looking for actually comes when they are spending time isolated, being removed from that career that they previously had. So that first kind of 30 days of just really silencing yourself and being able to sit with self to really kind of rediscover yourself. A lot of the answers that people are looking for are not actually through other people, but within themselves and taking the time to travel or go in nature and things of that nature. And then when it comes to kind of that rebuilding process and really kind of using someone as a sounding board, or, if they need deeper professional, help, then kind of finding what resource would match better for your individualized journey. So, it was,
Yeah.
yeah, really
I couldn't
interesting
agree
there.
more.
Yeah.
Like, we spend so much time doing that, uh, the information and the intuition and the insights really can only come to us when we're being instead of doing, when we're in
Right.
just like a more still receptive.
It's really interesting when you talked about it's more about the being versus the doing, right? And especially with kind of transitioning into entrepreneurship. And then also when I'm working with other physicians and healthcare visionaries that are kind of finding a new form of identity in a new career, it's also about the journey of becoming. Like, what are
Mhm.
your thoughts about, like, somebody separating from their career and then kind of developing into a new person and just really appreciating the aspect of becoming their new version of themselves?
I I kinda think about the did you ever have a hermit crab when you were a little kid?
No.
It might have been like a '70s thing, but,
Huh?
like, we had, like, hermit crabs, and you could even, like, paint the shell, and they, like, had a shell that they lived in for a while, but then they grew out of their shell, so they had to come out of their shell, and then without it, they were all, like, super
Yeah.
vulnerable, but you put a bigger shell in their cage, and then they got into it, and they could grow into
Yeah.
this bigger thing. Um, it's really uncomfortable and scary to shift and to do something different. Like the known and this is also like as a like a trauma-oriented psychiatrist, doing what is familiar and known is, seductive, even if it's abusive.
Mm,
So, that unknown thing is so scary, and that's also where, like, the growth is and where living super fully can be and where, there's value in it and it's hard.
yeah. Yeah, absolutely. Well, let's talk about your personal journey because I would like to know how you ended up going from being in the arts industry in New York City, right,
Yeah.
to integrative psychiatry. So take me back. What inspired your journey into the arts? Like, what specifically did you do in arts?
Oh, do you know what? I've always been a terrible student, so actually art, it wasn't hard to pass.
You were a terrible student, but you're a physician.
Yes. I
Okay,
can't even
okay,
yes, like, I, like,
okay.
literally, like, failed out of high school, got terrible grades, I got into only one college, I barely like, I'm a not
Yeah.
a great student, and so I got um, a fine arts degree, like a Bachelor of Fine Arts, because in college, it was just, like, more fun and interesting to spend my time doing photography and painting and writing screenplays and writing poetry, and then, we would, like, make short documentaries. So I ended up, uh I'm an East Coast kid, like, I'm from Philly, and then I moved to New York once I graduated college with a fine arts degree, with I think a screenwriting minor and a video production major, and I worked in film production. And it was just a super fun thing to do in New York City for a decade.
Mhm,
Um, but, like, if you're not making your own movie, you're working for somebody else, and that can be, soul crushing.
mhm,
But I was also always, curious, uh, and, I orient with existential angst.
mhm,
Like, I was
mhm.
always reading Sartre and Dostoevsky and Ayn Rand and then all of the really fascinating books about consciousness, like the Carlos Castaneda and The Doors
Mm,
of Perception and Aldous Huxley. And then there were these books that I was reading in my 20s about romantic neurologic dysfunction, like Oliver Sacks's. Um, there was a story about a man who fell in love with his wife because her laugh smelled like freshly buttered toast because he had
mm,
synesthesia. And for him, auditory senses were uh, olfactory
mhm,
senses. Um, I think the book was called The Man Who Mistook His Wife for a Hat because they couldn't see faces. They're just all these really interesting neurologic phenomena that happen in the world. And I've been curious. I really, when I was in my 20s, I wanted to join a think tank and smoke pot and just talk about consciousness.
hmm.
But I didn't know that that was a thing. I mean, I live in Southern California now, and apparently it
Right,
is. But,
right, right.
I'm a East Coast kid, so it's not. So I went to apply for graduate school. I was going to do like a neurosciency kind of thing. I ended up applying. Oh, I had to get my post-bac pre-med at Hunter while I was
Okay.
working because I
Okay.
didn't know any math or any of the prereqs to get you into
But why
medical.
did you choose physician? So I understand, like, kind of just wanting to
I
understand.
wasn't choosing physician. I was
Okay.
choosing the mind. So
Just
I was
choosing the
like,
mind. Okay.
yeah, I was like neurology,
Gotcha.
psychiatry. And also I had a
Ah,
really good sense of denial. So I was like, I'm not going to have to do a residency. I'm just going to go learn about the mind.
gotcha.
Like
Okay.
I
What
had a
did you think you were
fantasy.
going to did you have an understanding of what exactly you were gonna do as far as a career in the mind at all? Or you were just like, neuro, psychiatry, maybe?
No, I didn't. I was really enamored with the neurologists and the psychiatry books I was reading, and they were
Okay.
treating clients that had really like there was not a neurosurgical area that I was interested in, but just like learning about how people navigate what comes up in their minds in
Mhm.
relation to how they are like in the context of the world we live in. Like, how are,
Mhm.
like, this thing is happening in your mind. How are you dealing with that in your life, in your family, in society, in culture? Like,
Mhm.
all of that I found really interesting. Even like how we as humans engage with each other, society wise and culturally. Like, I think social anthropology is really interesting. And
Yeah.
there's like an alignment with that in psychiatry and psychotherapy. So I didn't have a particular plan that
Gotcha.
but also, my dad's a doctor, so somehow just, like, going to med school didn't seem crazy. I was like,
Gotcha. Okay.
I'll figure something out.
Right.
If they let
Is
me, I'll
there a
figure.
connection between, like, what you were doing in film production, maybe storytelling, narrative, or was it completely a separate experience?
It was a completely separate experience. Yeah.
Okay. I love that perspective because a lot of times you talk about leveraging your current expertise and figuring out what you can do to transition or,
Yeah.
transfer it into something new, right? And so a lot of times, a lot of people are spending time just kind of figuring out, okay, I don't want to waste the last 15, 20, 25, 30 years. So what can I bring with me? And you had an exact, like a complete separate experience, kind of giving you permission to completely redefine yourself.
Yeah. I was just like
Yeah.
this. I mean, I was, like, jumping in a dumpster, I think, on Fifth Avenue because the director changed his mind and he wanted sod instead of hay. He was like,
Huh?
"Every free hand. I wanna buy more dumpsters." So I was like, "Oh my god, is this what I'm gonna do with my life?"
Gotcha, gotcha. I love that, I love that. So you just can't you have permission to completely just choose
Yeah.
and switch. I love
Yeah.
that. Okay.
Totally. Um But it was great, living in New York in my 20s, doing
Mhm.
it was like a good part of my journey. Um, I suppose what has been a consistent thread in all of my, career and non-career beingness in the world is
Mm,
existential angst, though. Like, I had that
mhm.
in my film, I had that in my screenwriting, I was writing poetry, I paint. These, like,
Mhm.
sad monsters, so, like, there's always that thread throughout. So I went to medical school, which was awful
Okay.
because I was a little older than everybody. I didn't they were all, like, brainy, smart kids, it all came natural to them. It was actually the
Mhm.
only time I ever took an antidepressant. I was on Prozac for, like, 2 years in med school because I was, like, so depressed. Um, but
How
med
did your
school.
dad feel about you going to med school?
Oh, he was super excited. He actually came
Yeah.
to visit. Oh, so I only got into one med school.
Uh-huh.
It was, in Grenada, St. George's. It was an international med school.
Wow, wow, okay.
So we went to St. George's, and it's 2 years of academics. Med school's 2 years academics,
Mhm.
hardcore, and then 2 years of clinical stuff where you're, wearing a short white coat and you're standing in the back of all these
Mhm.
rotations in all these different hospitals. Like,
Mhm.
the kids with the longer coats are the residents. They stand in front. The short coat kids stand in back. We're still students. Um, so what I did learn through med school is that I'm a fainter.
You're what? A
Um,
fainter?
yes.
Oh, okay. Okay.
My surgical team whispered, "Bend your knees, bend your knees, bend your knees." So I would collapse instead of face plant into the patient.
Mhm. Oh my god.
I got very familiar with fainting. I know exactly what that feels like. So I was like, okay, psychiatry. So like my options are getting narrower and narrower. So I'm not going to do anything that involves like cutting into people or doing anything. So I do a psych residency, which I was at North Shore LIJ in New York, and it
Mhm.
was very oriented towards really an old-fashioned way of thinking and being, where we pathologize, we tell clients this is wrong with them, and they have to take this medicine in order for us to fix them.
Mhm.
And I found it quite heartbreaking, and really hard to do. Um, but then I did an addiction fellowship, and I was like, "Ah, this makes sense." Because again, this is people that are just like humans in the world that are having a hard go of it, don't wanna feel that, wanna find something else. Whatever it is they're doing is not working, but, like, this was like a population of humans I could engage in because something about this made sense. Like,
Mhm.
emotional pain and not feeling somehow like as humans, this human existence is a comforting, solid, feel-good working thing.
Mhm. Mhm.
Um And I've always been a harm reductionist, which I didn't know that it needed a word, but from New York, we're all harm reductionists. That means like you do whatever you can do to help people. Are you West Coast or where are you?
I'm a West Coaster, but I'm based in LA, but I'm nomadic.
So the like in LA, recovery is kind of like the other industry. There's two industries, I think, in LA, like film and
Yeah.
production and then recovery.
Right, right.
But the recovery community here is abstinence based. It's very 12 step. So there's a pretty strong orientation to a right way and a wrong way to do things.
Okay.
And that's not how I sort of, not the orientation of my way of thinking or being, nor was it the orientation of how I was trained. So when I moved out here from New York to LA in 2015, I was pretty shocked that, um,
So, so the way that you're explaining it, it just feels very rigid. Like this is the way that it's supposed to go, and it kind of leaves little room for expansion or other
mhm.
possibilities, which is kind of counterintuitive to the narrative that LA has as far as like this relaxed like atmosphere, and So, why do you think that is? Well, what happened there?
Yeah, I mean, um, I think AA is a great model and is super helpful and it absolutely gives people structure. But I also know that it's got a dark side, which is you have to acknowledge that you have no power and you have to um, I don't go to AA because I don't have
See, I've never been exposed to AA, so I wasn't even sure
right.
that was the kind of the messaging. Okay.
Yeah.
So
So I don't go because I feel like we're all in recovery for something. Like I'm in recovery from childhood and grief and this, that, and the other, but like I don't have a traditional uh I probably overdo Netflix and work too much and stuff like
right.
that, but it's not drugs or alcohol or gambling or sex or anything like that, that it's my like um but there is a particular mission around AA that is psychopharmacology isn't smiled upon. Like people that have been opiate addicts that needed Suboxone to get through were considered not sober. If you have paralyzing anxiety and you need benzodiazepines like Klonopin just to like get out of the house and go to the grocery store, that is considered not sober. And again, I don't want to make this a blank statement that that's considered not sober for all of AA. It's just some parts of AA
Mhm.
um, have also been a hard sell for ketamine assisted psychotherapy. Like they think ketamine is a drug. So adding a drug to somebody who's abusing drugs continues to be a problem.
Mhm.
So I have been hoping to continue to explore this conversation with the abstinence based sober community in Los Angeles, just so that we could have the conversation.
Right.
The same way that if your mom had a hip replacement, but she was an alcoholic and she hadn't drank in 30 years, you wouldn't say, don't take the pain medications. You're
Right.
given a medication for an intention, uh, for a limited period of time, intentionally, mindfully, carefully. And that's how we deliver ketamine. And even for people struggling with addiction, like
Mhm.
it's a tool.
Yeah, and I mean, it goes back to kind of the theme for the conversation you had was, everybody, it takes away that customization. Like every
Right.
unique experience is unique to each person. And that's actually the challenge with these generic programs, especially like
Yes.
everything kind of laid out. A lot of the work I do is principle based. It's not necessarily like instructional because everything is so unique. And I definitely see the benefits of having structure and kind of having an outline as a foundation. But when you are just kind of categorizing people in like this whole, it really takes away from the healing experience. Have you ever worked in the traditional space? Do you consider yourself kind of integrative, independent? Did you ever work for a group or hospital or anything like that?
Yeah, I spent a lot of I mean, I'm a regular Western trained addiction psychiatrist. I worked in
Mm-hmm.
detox and rehabs and ran
Mm-hmm.
in inpatient hospital based
Mm-hmm.
detox and IOP. You know what that stands for? There's a couple like acronyms in psychiatry. OP refers to it as outpatient. That's just like you see your doctor or your
Okay.
psychiatrist like once a week or once a month.
Huh.
IOP is intensive outpatient. There's PHP, which is partial hospitalization. So that
Mm-hmm.
speaks to, you know, a certain number of hours per day during the week that you're committed to outpatient programming. So as an addiction psychiatrist, most of my career, I was medical director for some of these IOPs, PHPs. Um,
And are you a completely on your own right now?
yeah, I worked for a couple of them when I moved out here in
Mhm.
2015. And like when I was back east, I had a like 1 day a week private practice and 4 days a week I worked
Mhm.
programs. When I
Mhm.
moved out here, I probably worked at the programs 1 or 2 days a week and had a private practice 3 and then 4 and then 5 days a week. So I wasn't
Mhm.
affiliated with the programs and I just had the private practice. But working in private practice, particularly as a psychiatrist, not only is it a bit isolating, um, we see the clients the least often and can have the most power if we're the ones with the prescription pads. So people are telling us like kind of what they want us to sometimes what
Mhm.
they want us to know so that we write what they want. And that's a really jaded statement that
Right. I
I'm like as an addiction psychiatrist, I've spent most of my or all of my career working in
Mhm.
addiction, which has sort of evolved to make me a trauma therapist because I'm not a
Mhm.
big fan of therapy. And I think that most of addiction is a behavioral response to avoiding pain. So let's explore the pain and where does it come from and how can we get to the root cause of that so you don't need to keep self medicating.
So
Um,
why aren't you a big fan of therapy?
I am a big fan of therapy.
Oh, I thought you said you weren't. Okay,
No,
okay,
I'm
so
not
you
a big
are.
fan of psychopharmacology.
Gotcha. Psychopharmacology. Okay, got
Yeah,
it, got
yeah,
it.
yeah,
Okay.
yeah. But
Mhm.
I really identify as an integrative psychiatrist. And by
Gotcha.
integrative, I
Okay.
just mean I'm open to integrating any aspect of healing, mind, body, spirit, soul. So the body is all of the hormones and sleep wake cycle and what are you doing and what are you bringing in, SETI, context,
Mhm.
culture, like all the things matter.
Yeah, absolutely. And I think we hear a lot about like, depression, ADHD, and, other similar mental health conditions. But what are some of the spiritual conversations you have with your patients? Like, what are some of those activations or triggers that are going on in their life that really cause you to kind of look at the whole mind, body, and soul?
I mean, right now we're at a really strange, pivotal place, politically speaking and geopolitically. Um, also, with the emphasis, the overemphasis of electronics over the last decade, the increase in young women committing suicide has escalated. And so much of our developing young identity isn't really about what we've done and what we know. A lot of it is
Hmm.
like what we think we know because we see other people do it. And there's this like, um, it's not a lived experience that we're responding to or engaging in.
It's not a lived experience. That is so. Can you be like a little? Do you have a scenario where you can be kind of more specific? Because I would definitely love to dive into that. A lot
Yeah,
of what we're reacting to is not a lived experience. It's what we think. Is it also part of like future thinking or what we feel is going to happen versus, the actual present?
I have a teenage daughter who spends a lot of time on social media and like
Hmm.
feeling that she needs to sort of live up to a certain societal and cultural norm that is not her lived experience. It is the experience of what is displayed on a
Right.
screen.
Gotcha.
So it's not even necessarily something that she's having with the kids next to her at school or at work, or it's like out there. It's like not even, we don't even know it's
Right.
real.
It's not. Right. It's not right. It's performative, right? Yeah. So the reaction that we're having is to things that are not even a part of our lived experience. It's displayed on a screen and obviously we can't even decipher what is performative, what is real, and we're having mental health problems because of things that don't even exist in our own reality.
Totally. And that's like from the teenage perspective, and then there's the older, like my mom is 80, and like I feel like most of people in her generation are just watching the news all the time, and it's like
Yeah.
so intense. Her like mood shifts based on what she's hearing and watching, and I have to ask her to stop
Mhm.
for a while or no, it's good, or like again, it's so and then when she's just doing like book club with her friends in the building or movie night, that's your lived experience.
Right. Right. That's so amazing. So I want to kind of talk through like what we can do to kind of grasp
Yes.
reality. So for example, moving from, a lucrative career into entrepreneurship, especially in the beginning, you're not going to probably produce, it's going to take time for you to produce as much income as you're used to having. But if you're constantly researching and learning and trying to, kind of figure out how to run a business, and you're looking at things on social media, on podcasting, and you're seeing like this
Mhm.
illusion of everybody, running a successful business,
Totally.
and you're like, it could be inspiring because it's like, okay, why not me? But then also, it could, again, make you feel like you're behind or you're not doing enough, which can cause overworking. And there's all of these elements. So one of the things I did was really kind of look at the research and see like, okay, for example, at businesses at this stage, typically like what kind of revenue are they typically bringing in? And a lot of business owners are bringing in most business owners in the United States don't make even as much as minimum wage in San Francisco.
Yeah.
So to really fully understand the data and the research is just to kind of really kind of level set your expectations. And that's just one example, just to kind of live in reality and assess your situation because you don't have that guidance from a boss or anybody else. And then what you're being presented is also not reality. So
Yeah.
that was one of the ways I had to grasp reality of like, okay, let me figure out what bar I want to set for myself,
Yeah.
so that I can understand that I'm pacing. So what are some other ways that people can really, what can they do to really start grasping reality and stop trying to live their life through a screen?
Um, do things in person. Like I have seen all those podcasts and Instagrams and this, that. But then when I went to events for small business people,
Hmm.
um, everybody there had a similar uh conversation and pain points, like some days are great and I feel really like passionate and driven, and then there's like scarcity mindset, which happens to all of us,
Mhm.
and the overwhelm of hiring versus not hiring, and can I be friends with my employees, and like just
Right.
like all the things that happen and come up. It's just really nice to know that like you're not alone in that, and these are like normal things that happen along the way. And like making mistakes and making certain decisions and then being like, oh, who's got a lawyer? Am I supposed to have a lawyer? Oh shit, I should have, like
Right.
um having conversations with in person with other small business people, because there's an anonymity that you don't have to really be honest or get to be honest as much,
Mhm.
if you're not like at a dinner event where people are showing up to talk about their stuff.
I like that. I like that example. Like, do things in person, collaborate with people who are doing what you're doing, and you'll see that a lot of us are very similar, have the same pain points.
Hmm.
And the people, well, I can go really deep into it, but
Yeah.
there's people who understand that and know
Yes.
how to sell to people based on these circumstances. So it's very important that you kind of really level set and really set the right expectations. So let's go into, like, even for example, like your daughter, a teenager,
Hmm.
when they're looking at other experiences through a screen, because that suicide rate is alarming. Like,
Oh,
what
I
are
know.
some things that people can do just in everyday life to really stop that comparison?
You know what? I'm an adult oriented psychiatrist. I don't treat kids much,
Okay.
mo- mostly because I don't like to medicate young minds, and a lot
Well,
of kids
maybe what
come
about like
so. So I feel like
like a family, like someone in a marriage, and they see like a beautiful couple, and they're like, "Oh, their marriage is perfect, and I'm having all these issues with my partner." Maybe the grass is greener on the other side. Like,
yeah.
what would you kind of say in that perspective?
I mean, I feel like it's you have no idea what you're looking at when you're looking at things, you know?
Yeah.
Like it's so people
Yeah.
show what not only do people show what they want to show these days, I don't even know if it's real. Like I pointed out
Yeah.
a really cute little like animal with a baby, and then it brought a little kitten in, and I was pointing it out to my daughter. I was like, look how cute. She's like, that's AI.
Yeah. Yeah.
So like whatever it is that we're looking at that is other successful young teenagers having great lives, or marital couples having amazing vacations and raising kids, and people, I don't know what that thing is about us as humans that like drives us to want to show to like people we don't even know if they're looking or not, like this success we've had, or this like wonderful at like, can it just be nice that you're experiencing it? Like why does it have to be seen or witnessed?
Right. Right.
Like
What do
it
you
there's
On the other end of it, there's a lot of business owners who really need the visibility, to expand their business, right?
Yes.
And I was actually at a live shoot yesterday, and one of the things my client was saying is like, I don't want this to fall on deaf ears, right? I want to make sure that this is seen and this is successful. And one of the things I just told her is we just have to start measuring success differently, especially when it comes to long-term strategies, right? Looking at collaborative experiences, measuring things like consistency. A lot of people are focused on the end result without really kind of putting in the work to actually make it happen. And just as, we work so hard to achieve a certain place in our careers, that's the same effort you have to do in your business and everything any venture that you start. So just kind of really, my advice was just kind of looking at your metrics differently, and looking at what you're measuring differently as well, to really kind of measure success.
I agree, and that also, speaks a little bit to stuff that sometimes comes up with, psychedelic therapy in conversation, and even before psychedelic therapy, just in general, like, what's your value system? Like, what's important? Are you are you satisfied? Do you feel good in what you're doing? Do you feel connected? Do you feel like you're making a difference? Is there a purpose? Because I feel, if it's simply about like money and making a certain number, that like that's one way of marking success, but I don't But I think that that's limiting, and I also don't think it's that healthy if we're not also like, what's the work-life balance? Like, do you also have rich relationships and friendships and time in nature and exercise and nourish yourself in ways that feel good? So, like,
Mm.
all of these other things that are measures of success. And what is
In the
success? A
begin
successful life?
Right, right. What does that mean to you? One of the things that in the beginning of my transition I was really obsessed with was this idea of life purpose, right?
Mhm,
And like figuring out what is my purpose? Why am I here? Like I know what is my purpose. And I have a great grasp on exactly what that is, but I was confused with it being tied to something specific, right? Rather than just like a feeling or a mission or just being right and understanding that that is purposeful. I was like, I need to know specifically what is my life
yes.
purpose. And I can imagine kind of diving into assisted psychedelics or just kind of personal awakening experiences that allow your mind to expand to really kind of reach that moment.
Mhm.
What do you say does anyone ever come to you, like, kind of, like, lost and, like, really wanting to know, like, specifically what that thing is they should be doing and, like, can't rest until they figure it out?
Um, I don't think I've seen as much of what's my exact mission as, life changes, like, um, late 70s, had a huge career that defined most of my life, retiring, like, kind of now what? Like, that
Right.
spoke to a lot of, like, my worth and my
Mhm.
identity, why I was here, what I did, was I missing something the whole time, or how do I be in this new phase and and f and be happy in it? Like,
Mhm.
what else is there? Which ends up being more of the personal and spiritual growth emphasis of ketamine-assisted psychotherapy, which is less about, um, healing a particular wound and
Mhm.
more about expanding the way we think about ourselves in the world.
What are some of those discoveries, like, after, they're retiring and they're kinda figuring out, like, now what? Like, what kinda discoveries are happening through that process? What are they learning about the life they lived and the career that they had?
Um, some have found that, like, wow, I can reflect on the way I was raised and how, kind of my focus was somewhat narrow in what I allowed myself to feel and do,
Mhm.
uh, in order to achieve what seemed like the goal.
Sure.
And now that I'm here, I'm recognizing, like, I may not have lived as fully, but now I can. Like,
Right.
so some people recognize that with a sense of sadness and grief, and some people recognize that with a sense of hope and opportunity. So it can be a realization that can land a couple of different ways.
Yeah. And that's one of the things I've found, and even in my own life, is this sense of wanting to make sure that I lived a fully actualized life and fulfilling life. And, God forbid anything happens, I do feel like I've fulfilled
Mhm.
and lived a beautiful life. And that's one of the feelings that I hope to hold on to and continue to grow through. What can I mean, if someone's feeling like they haven't lived up to their full potential, or they're not, for a better way of saying it, they're not living a fulfilled life, and it's something that they want to do now so that they don't regret it in the future,
Yeah.
but not sure where to turn. Like, what would you recommend?
Um, so I feel like that's where we are asked to slow down and listen and pay attention to what wants to be seen, what wants attention from us, what parts of us don't feel like they got the attention, or there's not a really clear answer because it's a slower process of, like, what's it like to slow down? Like, how do you feel? And 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 then we, like, slowly work with people to track that, to explore both like what might feel sad or painful or frustrated, and then what do we actually want now? Like now that we're,
Mhm.
you kind of have to, you kind of have to heal some of those things in order
Yeah.
to release and then be open to the bigger.
Yeah, and do you have this belief well, do you believe that the answer is, like, always been there? And, like, the healing part is really kind of uncovering that?
Yeah, I mean, I feel like a lot of us are traumatized by life. Life is traumatizing. It's
Yeah.
hard, man. Like, um, not only just like parents, messaging, society,
Yeah.
expectations, um, and we're acculturated not to ignore all of this and just be like, what do I want?
Mhm.
Like, what feels right to me? Like, even, and this is probably more of my like philosophical problems with life in general, like
Mhm.
kids wake up too early. They're told to go to school. We're supposed to eat at these times a day, whether you're hungry or not. Like, so we're kind of uh, schooled not to listen to what we want, to engage. And so to find that balance where if you want to live within society as we know it, but still tap into like what feels right for you, it is a balance.
Right, it's like, the conditioning and the programming, and it's almost like, another, physician used the word, unlearning.
Hmm.
And really kind of you're right, it's kind of all of these things being presented to us, and I almost feel like the process is like removing more than it actually is adding, right? It's like
Yes.
I'm looking
Yes.
for these things to do. I want to do this. I want to do this. And I feel like when it comes to the healing process, it's more about removing and,
Yes.
getting and being in order for you to be able to expand to where it is you actually need to go. I love that. So, what kind of creative things do you still do to stay connected to your previous life?
I still paint and read and journal and write, and I find a lot of value in time in nature, which I probably don't do enough. And I think I guess what I used to do, probably more in my 20s, that I'm starting to do more now that I had a 25-year marriage that I'm separating from. So just like more time with friends, just more like relaxed fun.
Mhm. Do you think, like, just, like, kind of your clients that, are in this space in their life where they're kind of, like, wondering, like, did they live it fulfilly or, like, this hope of, kind of going for more or having that regret? Which kind of end of the spectrum would you be on?
I actually think it's more of a daily practice. Like I think life is a practice. We just practice
Yeah.
every day trying to do the do. And for me, my practice is what I do naturally is that yang doing energy where I'm uh thinking about something and doing something and thinking about something and like, oh, that's a thing that can be done. That's a thing we can create. That's a thing we can co-create. That's a So my practice is quieting that, doing nothing, um, to just be in gratitude for what I have, slow down, breathe, appreciate, because I feel really strongly, at least for me personally, that it's really hard to tap into uh, intuition and the bigger knowing while we're busy doing.
Absolutely. So taking that time and unfortunately, I've encountered people who are only have the opportunity to do that once they've actually been, like, removed or have this huge life
Yes.
transition, and maybe that's the way that it's supposed to be, but it's just like, I really hope that people listening to this, like, we could really try to find that space in where we are today. Being more intentional about it, because it's almost like because we haven't been intentional about it, now there's these things that are being placed in our path in order for us to actually start to pay attention, right? Uh,
I feel
because
really
Go
strongly
ahead.
about that. Yeah.
Yeah. Yeah.
But it
Because
could
I
be
feel like
5
had we
minutes.
been intentional, yeah, it could be 5 minutes. It could be just 5 minutes, taking the time to yourself. And we're not saying do anything, because it's not even like go do
Yeah.
meditation, go do this. It's like just take that 5 minutes to yourself, because the more the intention grows, and obviously life is full of all of these transitional periods and these activations and triggers and changes, and the more intentional we are about taking that time every day, n- when these changes do arise, we'll know the reason why. We'll have that clarity already. And I feel like it would help us navigate more seamlessly than we would if we hadn't take the time. Then all of a sudden, now, boom, we have all of this time and we don't know what to do with it.
You pointed out something that I see sometimes with clients where they work so hard that they get forced to take the time because they get hit with like an illness or something falls apart or, like they've spent so much time ignoring really themselves and what they need and want that uh something internally breaks down and they're forced to slow down.
Right.
So before you're
Absolutely.
forced to, do it because you want to.
Yes. And it's just like 5 minutes to just do nothing, sit there silently and reconnect with yourself, because that's kind of and I love that we're having this conversation, because a lot of conversations are can we do, what next action can we take, and it's like from this conversation, really just understand taking that 5 minutes to yourself today is going to help you continue to navigate this beautiful transition that you may be
Hmm.
experiencing. And that's all you need to do
Yeah.
is be. Yeah, absolutely. Well, thank you, Dr. Eva. It was a pleasure connecting with you and kind of diving in and kind of guiding this conversation. Thank you guys so much for listening in. This is Dr. Eva. I'm Bianca Ariel, and you're listening to Recalibrated Vision. Make sure that you always and forever stay free. Have a beautiful day.